Health, Harris Medical Center. We welcome Cassandra Feltrop to the program, and we're going to talk a little bit about the Unity Health Foundation. But first of all, welcome to the program.
Thank you.
Tell us, Cassandra, a little bit about you growing up and education-wise.
Okay.
Tell us a little bit about you.
All right. Well, I am actually a White County girl. I grew up in Rosebud, kindergarten through 12th grade in Rosebud. Graduated from high school there and went to ASU BB for 1 year before I transferred to Ouachita Baptist University, where I spent my next 4 years, with one of them being an exchange student in the Soviet Union.
Really?
Yes.
Interesting.
So it was very interesting. And then I left there, graduated, and went back to Searcy and worked for a design shop as a graphic designer. And then within the year was working for Central Arkansas Hospital.
Okay.
And worked there for 4 years before I made the move to White County Medical Center, which is now Unity Health. So
I gotta ask you this, didn't know this. Tell me about the year of the exchange. So tell me a little bit about that.
Yeah.
Number one, why did you want to do that, and what you got out of it? Because you always get more out of that than you think you're going to get after you get home. You get to look back and say, I got a lot more than I thought I was going to get.
Yes,
Tell us about
sir.
that.
Well, it was a dream. When I was in 6th grade, I remember seeing the Kremlin and the beautiful Basilica Cathedral there,
Yeah.
and wanted to go there. And when I got to college and it was an opportunity, my roommate and 2 close friends went with a group from Ouachita. We learned a lot about life. We learned, we stood in line for rations, for food, for
Really?
sugar, and our meat and potatoes and eggs came in a little bag that we were rationed, and we spoke the language. We spoke 0 language when we went,
Sure.
but we did a 6-week class of 6 days a week for 6 hours a day for 6 weeks learning the Russian language.
Wow.
So we were not fluent, but we could negotiate and navigate through town when we were finished. I was there for about 6 months when Desert Storm broke out, and we came home because we were closer to the war than we were even to Moscow.
Wow,
So we were in the
okay.
very southern portion of Soviet Union. It was Kazakhstan. And they actually broke free and gained their independence while I was there.
What an experience
Yes.
for you.
Yeah.
I mean, boy, it's just so, it's just awesome to hear
Yes.
that you say that. The number one, that you wanted to do that, and then you were there at a time when that happened. I mean, it's something that you live with and can talk about the rest of your life.
Yeah, it
Well,
was
great thing. Well, we find out lots of things
Yeah.
about when we ask questions
Yeah.
and so on and so forth. But, okay, let's talk a little bit about Unity Health Foundation. First of all, what is that? What do you do? I mean, what exactly is Unity Health Foundation?
Okay, well, I started back 19 years ago at Unity Health as the Director of Marketing and Community Relations. So through those years, we had a foundation. We're actually celebrating our 20th year this year.
Wow.
And so I worked with the foundation from the marketing perspective, and then it came about an opportunity for me to also begin working with the foundation. So I've been with the foundation for about 12 years now.
Okay.
So, but our Unity Health is a non-profit organization,
Sure.
and so every bit of profit we make goes back into the organization, whether it be through building, equipment, or human resources.
Okay.
So, so what the foundation is a separate 501c3.
Okay.
So we support Unity Health. And so we are there to help raise funds for new technology, renovations, equipment, programs, scholarships, and things that benefit our community and our patients. We come alongside and help provide funds for different projects at the hospital.
Well, just kind of just off the top of your head, give me some examples of some of the fundraisers that you have done. If there's anything in the future that you need to talk about, we'll talk about that too. But give me some example of how we raise money.
Okay, well, we're set up in a 6-committee structure,
Okay.
and in Searcy, we have done a couple of campaigns. We raised money for our Cancer Center of Excellence, and all these 6 committees over the course of 3 years raised about $1.2 million to go towards that through different activities. And then we had an associate or employee-only campaign where we raised about $45,000 and purchased a van to help transport our patients, because everything we do is for our patients.
Sure, absolutely.
And then we just have recently finished our second major campaign in our new Life Center, and it stretched a little over 3.5 to 4 years, and we've raised about $1.6 million in that campaign.
Wow.
So we have really been doing several different kinds of fundraisers, but mostly we ask person to person because that's what we find is the most effective. We have had events and restaurant give backs and that kind of thing. So, as you know, about 2 years ago, we partnered with Unity Health here in Newport. Actually, we changed the name after we partnered with Harris. Yeah. So, so we've kind of been, the Unity Health has been, as you know, pouring a lot of funds and support into this organization here and made a lot of improvements and renovations and purchased new equipment and technology, making great strides here. So we really haven't been in the public raising funds for the hospital here, but behind the scenes, our associates have been partnering with us, and they have helped raise money for the new Life Center renovation here. And so they've between the associates and a few community partners with Healthy Women of Unity, we've raised over $55,000 for the new Life Center here in 2 years. So we do everything from just a letter direct mail piece to friend raisers to in Searcy we have give back events. So say a restaurant will say, let's go on Tuesday the 25th, everything that's purchased between 3 and 6 p.m., we'll donate 20% of that to the foundation. We've got a jewelry store who will do that for us over a 2-week period of time. They give us 20% of profit from our associates who go in and purchase. So it's a good partnership for them, for us, and then they donate 20% to the foundation. So we've not yet started doing that kind of thing in Newport, but we're getting really close. We've just started getting together our committees up here. So John and Andrea Connor have agreed to be our development council chairs up here. So I don't want to go naming names in case I forget somebody, but Miss Judy Feltz and Dee Dee Dupree have agreed to be our annual gifts chairs. So they'll be working with gifts where people give $100 a year. Miss Jennifer Eddington and Ashley Boriani are working with our associates here. And then Miss Jane Parnell and Dr. Patty Mullins have agreed to come on and help us with our special signature gifts level. And then Hunter Smith is helping in with our Cornerstone Partners, which is our business and industry. So we're just getting the groundwork laid here in Newport. We've already, like I said, seen some benefits here, but we're getting ready to start involving more of the community. We wanted to come in and show we really are invested in Newport, and now we want to try to get more people to start investing with us. So,
well, there's no doubt that you guys are doing super work, and the people you just named, what a group of people from Newport, Arkansas that's going to be good for the foundation, no doubt about that, and Unity Health and Harris Medical Center here. I got to ask you this before we get out here. It's not necessarily about the foundation, but why you in the healthcare? Why you said, when did you want to get involved in hospitals as such, and you talked about dream of going to Russia. When did it hit you that that's what you wanted to do? Because obviously you do quite well at what you do.
Well, truth. You want the truth?
Absolutely.
Okay, so when I was 15, I thought I wanted to be a doctor or a nurse. So I went into what used to be the Candy Striper program at Central Arkansas Hospital, because that's where my grandmother would always go to the hospital with Dr. Porter Rogers. And so I went that summer, and I got assigned to the lab work the first day, and they gave me the little container where the little vials of blood and stuff that you got to carry around. And at the end of the day, I said, okay, I can't do this. You know, I really like to talk, and I can alphabetize and write. So
there you go.
Where can I be most beneficial? And so I went down the line of business office for the rest of that summer, and I always knew I wanted to be in a job where I could help, give back. And I believe God led me to that job at that graphic design shop right out of college, because I was designing newsletters for both Central Arkansas Hospital and White County Medical Center. And they snatched me up as soon as there was an opening, and I believe God brought me to this job, and it's where I'm supposed to be.
Fantastic.
And I love to be able to give back. We do so many great things for our community. Michelle Fauci does a great job here in Newport, as well as Margaret Goodman, and all with our prime times and auxiliary. And that's really what got me back in healthcare. Was I went in as a secretary, and within 2 years became the director of marketing, and love what I do.
We have information also on a Facebook page and a website, I guess, if people want to look for more information.
Sure, you can just go to the unity-health.org website and go to the foundation page, and it's got several different pieces of information about the foundation. And then we have a Unity Health Foundation website or Facebook page as well.
Right.
And then our phone number, you can call us anytime. For our office is 501-278-3186 or 3191. Either one will get you to our office. And we just love what we do. We love being able to give back and help out. And we've got a new campaign coming up in Searcy that we're going to be announcing really soon. And then on the heels of that will be a campaign where we'll go community-wide here in Newport, and we'll be talking about all the wonderful things we can do for our patients here in Newport.
Well, there's no doubt that the foundation is doing great things, and there's no doubt that the leader of the foundation, there's nobody, I can tell you in 5 minutes time visiting with you that the foundation has done real well to put you in charge, and I feel the love. I feel the love that you have for what you do. Cassandra, we appreciate you so much for coming on and joining us here on the Business Spotlight. And we do this each and every month at Unity Health Harris Medical Center, and talk with some of the folks that make it work, and Cassandra and the foundation certainly do. Thank you so much.
Thank you.